Hi, my name is Dr. Kerry Tapuzian, and you're watching Ask Dr. T. Today's question is in regards to breast cancer prevention. First, let's talk about some risk factors we have right over here. And these top ones are some conventional risk factors. The first two right up here, these are genes that are associated with increased risk of breast cancer, actually up to 80%. They're called BRCA1 and BRCA2. Then family history. If you've got a mother, aunt, sister that's had breast cancer in the past, you're at increased risk, unfortunately. And then early menstruation before 12 years of age and late menopause after 55 years of age. These are risk factors. No children or first child after 30 years of age. If you've been on birth control pills, usually for more than 5 years. If you've taken synthetic hormone replacement therapy. If you use alcohol. Now, why alcohol? Why is that a problem here? And basically what happens is if you drink an excessive amount of alcohol, it affects your liver, and you're not able to metabolize your hormones, specifically estrogen, which we're going to talk about in a little bit. If you're overweight, it's also a risk factor, and the problem here is that any fat cells that you have on your body will actually produce estrogen. And again, it comes into something we'll talk about down here too. And then low physical activity is also related to risk of breast cancer. Now down here what I've got are my risk factors, or Dr. T's risk factors. And let's talk about these right now. The main one we're going to talk about is estrogen dominance. And what that means is that you have an imbalance of your hormones. You have elevated estrogen versus your progesterone levels. You've got two of your main sex hormones are estrogen and progesterone. And what estrogen does typically, or one of its features, is that it causes growth of tissue. Okay, and progesterone, what it does is it causes differentiation or maturity of tissues. So if you have low progesterone levels, which can occur in early menopause as early as 35 years of age, and you've got a relatively elevated estrogen levels, you're going to have increased growth of tissues. And that's another way of saying it's cancer. Okay. So estrogen dominance, other things that will cause this is if you're on birth control pills, because this will cause you to have an increase in synthetic estrogens. And something else that will also occur is the way that you break down your estrogens in your liver. And I've got a little diagram here, and basically what happens is your body takes your estrogen, goes to your liver breaks it down. It's not supposed to stick around for long periods of time. But your liver has three choices in the ways that it'll break it down. And we'll call it 2, 4, or 16 estrogen. And the goal is to have more of these smaller estrogens or weaker estrogens versus the ones that are stronger. Because if you have a higher amount of the stronger estrogens that are getting broken down in your liver, that's an increased risk of breast cancer as well. And later we'll talk about how you can test for this and how you can actually treat this. Other risk factors. Stress is a big risk factor for breast cancer. Statin use. Statin is a medication that's used to lower cholesterol. And there are studies that show that using statins will also lower a supplement called coenzyme Q10. And then there are other studies that show that if you have low coenzyme Q10 levels, you have an 800% increased risk of breast cancer. So just by taking one of these medications and not supplementing with CoQ10, you're at risk. Autoimmunity and inflammation. If you have one of these, your immune system's just not working as well as it should, and so it's not necessarily going to kill off the cancer cells when they're young. And inflammation is going to cause damage to tissues in your body, which is a risk factor for cancer. And then also insulin resistance, which has to do with your diet, will cause increase in estrogen levels, which goes back up here to this problem. Now, let's talk about some different testing, preventive testing that we would normally do. And, of course, right up on top of the list is doing liver function tests. And there are screening tests that can be done with blood, and then there's also more specific tests that can be done with urine testing. Estrogen metabolism testing. And what this does is this will, through a urine test, we can tell how your body is breaking down estrogens. Are they the good estrogens, the weaker estrogens, or the stronger estrogens? We also would check a vitamin D level, CoQ10, your B vitamins, and also a marker of inflammation, which is called CRP. And then we would also do saliva testing for your hormones. Your sex hormones, we would check your 3 estrogen levels, because your body makes 3 estrogens. Your progesterone, we would check your stress hormones, cortisol and DHEA. We would also check a testosterone level, and we would check melatonin, because it's also been shown that lower levels of melatonin is a risk for breast cancer as well. Okay, next, let's talk about some specific prevention. And up on top here, I've got Dr. T's top 7 supplements. And the first one is cruciferous vegetables. And those are things like broccoli, cauliflower, bok choy, radishes, kale, rutabaga. I mean, all these things, and they call them cruciferous because if you cut the stalk, it looks like a cross. But in these different types of vegetables, there are components called I3C, or indole 3-carbinol, and something else called DIM. And what they do is they actually help your liver metabolize the estrogens into the weaker estrogens. So by taking these things, you can actually decrease your risk of breast cancer. Folic acid and B vitamins, it's been shown that there is a 80% risk reduction in breast cancer because of that, if you take them. The other thing that this also does is your B vitamins and folic acid will help your liver break down your estrogens again and other toxins in your body. Vitamin D3. Now, vitamin D3 helps boost your immune system. And if you live in Michigan or in Northern America, unless you sit out in the sun every day and do not use sunscreen, you're going to have low vitamin D levels. That's just the way it is. So you've got a choice. You can either lay out in the sun, throw away your sunscreen, or you can take supplementation of vitamin D3 somewhere in the range of 2,000 to 4,000 international units a day. Whey protein. Most of you are probably familiar with this. If you're not, curds and whey. Whey is actually, if you take yogurt and you strain it, the liquid that comes out is whey. Very good for your immune system, very easily digestible, and it has an amino acid in it called cysteine, which has been it's been linked with lowering the rates of breast cancer. And this usually comes as a powdered supplement that you can get at most health food stores. Green tea. Okay, green tea will inhibit a gene that's associated with breast cancer called HER-2. And again, coenzyme Q10, and we talked about why that's important. Evening primrose oil inhibits a gene that causes up to 30% of breast cancers. So these are my top 7. Now, these are just some other strategies which we've kind of talked about too, but we'll just go over them again. We've been talking about optimizing estrogen metabolism, or your liver and your gut being able to get rid of your excess estrogen. But here's some other things you can do. Probiotics, which are like the active cultures that are in yogurt, and fiber. Because what's going on here is these are actually in your gut. It's helping your body get rid of the estrogens so they don't get reabsorbed into your system. Another thing you can do is something called sulfation or sulfur, and you can get these from eating garlic or onions, or you can get Epsom salts, and you can take an Epsom salts bath once a day. Epsom salts is magnesium sulfate, and that sulfate actually will absorb right through your skin. Not only is that going to help you with stress, but it helps your liver detoxify your body and help get rid of estrogens. How to control inflammation. One of the best ways to do that is with fish oil or cod liver oil or the omega-3 fatty acids. Another way is to take certain kitchen spices. For example, cayenne pepper, turmeric, ginger, quercetin, which is in onions. These are all anti-inflammatory, and either you can use them in your kitchen or in your foods, or you can buy them as supplements as well. Controlling insulin is very important, and that's through diet, not eating any refined carbohydrates, staying away from sugars or starches. Again, reducing stress. And it's hard for people, but you really need to have something to look forward to every day. I mean, if you don't, you're constantly stressed 24/7, and that's not a good thing. I mean, these are some examples, that I put down here: yoga, tai chi, exercise, hobbies, religion. But maybe you just need to or would like to take a nap in the afternoon or read a book, something that's going to decrease your stress on a daily basis, and also something for you to look forward to. And then boosting your immune system, and we talked about some of these, vitamin D, whey protein, garlic, and also healing your gut. Okay? And this last one may not seem to necessarily make sense, but you've got to think of it this way. 70% of your immune system is located in your digestive system. So if you're feeding it the wrong foods, if the wrong type of bacteria are growing in it, or if you're having any problems with it, it's going to have an effect on your immune system. Any questions out there? There's a question. You can email me at askdrt@gmail.com, or you can visit our website at www.cfhll.com. I'm Dr. Kerry Topouzian, and this has been Ask Dr. T.